Most of you know me. Just one other thing, we asked about how many people have, how long you've been. How many, this is your first conference? So welcome. That's looks like a good third of the room. So listen, a lot of this is coming at you like, you know, opening up a fire hydrant, okay? And you can't take a drink of water from a fire hydrant. That's okay, come to the side, take a little water from it. As you come to more conferences, you'll be able to take bigger gulps of water. Just take it easy, it's okay. The other thing is I want to talk about my Hawaiian shirt. There is, some of you know the reason I'm wearing a Hawaiian shirt. One of the members of my support community in Northern California passed away in May. And he was someone who always wore a Hawaiian shirt. And honestly, for the first 2 years of my diagnosis, for every meeting that I went with an oncologist or any other specialist, I wore a Hawaiian shirt. So I'm wearing this in celebration of his life because nothing really bad can happen to you in a Hawaiian shirt. So that's why I'm here. I'm doing that. And so Kevin, this is for Kevin. Julie knows Kevin well and his family as well. I have what, which is what all of you have heard. This is kind of, I call it living in a neuroendocrine world. Welcome to a patient's world. On my birthday, as a matter of fact, this was published in the ASCO Post. It was a story about living with a rare cancer in my Dr. Seuss world. And it was a lot about my personal journey, and I'm not going to talk a lot about my treatments or what I've gone through, except for this, and to let you know that it's available online. The reason I wrote it is, actually I was sitting reading my son's second grade class. I was reading Dr. Seuss on Dr. Seuss's birthday. And I realized that how lucky I am. And for all of you who know me, all the places I will have gone or have gone, it just came to me that this would be the right way to discuss neuroendocrine tumors and what we're trying to do to make it so you don't have to be lucky, so you don't have to go to all these places, and this article came out. So this is about as medical as I'm going to get for a little bit. I was diagnosed, I was diagnosed in it's not 1207, I'm sorry, it's 907. My first conference, was an international conference, that's right, 907 blind pickup. My first support group was in December of that year in 07. Because of the support group, they really encouraged education, just as we've heard here, and the first international conference that I could attend was actually in Toronto in October of 08. That probably changed my life. From that point, I learned about gallium-68 for the first time and went up to one of the presenters and said, wow, could I go get one of those? And that sent me off to Germany to get a gallium-68 in December of 08. I was stable for nearly 18 months, but I started having progressive disease soon thereafter, and it led me without very many choices, and we'll talk about that in a second, to have my first PRRT in May of 09. One way or another, it ended up that I met some people at a meeting in Germany as well, who happened to be from UCSF of all strange places, who was the director of outreach for the Society of, well actually, my first medical society board is the Society for Integrative Oncology, and that's why I'm on those first. And just last month, no, it's this month, I was awarded the president, their first President's Award to a patient was given to me in June, which I'm actually really proud of. The one thing that I'm going to stress for all of these, for the rest of the slides, let's see if I can get this thing to work. I may not. Oh yeah, there I go. So learn, network, give back, and have joy. So there is no class for this. No one, that moment you get that diagnosis, there is no class that says this is what you do when you go have cancer. We don't prepare for it. we just get it. In a blink of the eye, your life will change forever. You guys know this. But everyone comes out of the woodwork and tells you, how many of you got the cures? Got emails that says, try, I don't know, ginger, try, let's see, hands up, who got all the, wow, about 50%. How many of you use the University of Google? Do you have a degree? So I like the University of Google, but remember there's a lot of stuff in the University of Google. If you Google the word cancer, I didn't do it lately, but I can't remember how many hundreds of millions come up. The first one that comes up is nothing but a quack site. So really be careful in the University of Google. I'll do this too. Take a deep breath. As we know, you're not alone. There's at least 100,000, 120,000 patients in the US. There's 250,000 patients in Europe. There's 2 million patients around the world. But on top of that, even though we tend to think there's 10 or 12, maybe 6 centers of excellence in the United States, there really are thousands of medical professionals around the world who are researching this, who are trying to think through this, who have your back. Ron hasn't talked about it, but once a year they get their scientific advisory board together and all the researchers they fund, and that's a room of 200, just about 200 researchers from around the world. NetNets will get together a little later in October this year. There'll be 400 people in that room. eNets, you were at eNets, how many people were in that room? A few thousand. Okay, so it's not just 2 or 3 people. It is thousands of medical professionals trying to get there. And their life, other than scotch, this has become their passion. So what do you do? For me, there weren't a lot of options. Watchful waiting, how many hate that term? Okay, watchful waiting, we don't want to do it, but the other thing is we've gotten from the popular media that we need to war, fight, battle. Those of you, how many had 10 years plus? How many people have been at war for 10 years? Is that devastating? Is it hard to use that word war? Do you want to be at war with your own body for 10 years? This is a piece I wrote for the JNCI, the Journal of the National Cancer Institute, trying to get beyond war, because to be at war for decades is a really challenging thing. Any country that's been at war for a decade, it's hard to live that way. I changed that word myself. I call it watchful learning. I use the time that you're waiting in between treatments and what you're doing next as a chance to learn, as a chance to restore. In my case, there wasn't much to do. I was not an operative case, and my scans went just about everywhere. My oncologist told me about a clinic across the street. It was an integrative oncology clinic that's run by UCSF. We didn't talk about cancer for my first hour of intake. The first questions were, what are your hopes? What brings you joy? Anyone know who said that? Oh yeah, that's because I told you at dinner. Really, no one? He's an LA musician. This is what Warren Zevon said on the David Letterman show when he made his last appearance. And David Letterman asked him what it's like to have cancer and what things could he impart on someone who didn't have cancer and who didn't know what that was. And Letterman and Warren Zevon responded, I've learned to enjoy every sandwich. So bring joy, enjoy every sandwich. I started on a path of using integrative oncology as part of what I do. It's a whole person approach. It's not a treatment for NETs. I know there's a question coming up in the Q&A for that. It treats the symptoms and the impact of cancer, of living through having this type of disease. Sorry, got a little screwed up here. My first board that I was asked to join, Professional Society Board, was the Society for Integrative Oncology. I was an executive board member for 4 years. You can see the mission of the Society for Integrative Oncology. I now chair patient advocacy for the society. What's behind this is what has helped for me. So what we do as part of the society, you can see here, is we want to advance the evidence-based, comprehensive, integrative healthcare to improve the lives of people affected with cancer. We use the word evidence-based, and there's not a lot of evidence for a lot of different things, but we really do go through and support investigators doing evidence-based. For me, the things that I can say that really, really worked, I had PRRT. I had a hell of a lot of fatigue with PRRT my first time. I did restorative yoga. It really managed my fatigue. So there's a lot of different ways that integrative oncology can help with nausea, with other things of fatigue as well. So I really recommend and there's a great integrative oncology group over at UCLA, so I'd really recommend that you go see that if you can. Support group. Okay, everyone knows where that one came from? Really? There's not one hand that knows where that came from. Excellent. Knowledge is good. So knowledge is good, and that is one of the key things, learn. There are really great positives about support groups, and we've heard them before. The sharing of information, the supportive environment, the place to belong. For me, it was the first time I actually saw anyone who had what I had. Well, not exactly what I had, but something close, as we're all somewhat different. There are some challenges, and I want you to be aware of them so that you're thinking of them as well. Not all the information you're going to hear in all your support groups is going to be accurate, evidence-informed, or relevant in your case. We are all different. We've heard a lot here already about things that, carcinoid syndrome, we went through a whole thing. What percentage of you are going to have carcinoid syndrome? Not very many of you. Okay, so, and if you're a PNET, we get things of, everyone must do the following, or these are the blood tests that you must have, and people get very adamant about things. But remember, you're an individual, and what's important is what is your individual makeup. You are an N of 1, and most of the stories you will hear are N of 1s, and N of 1 does not provide an evidence base, so be aware of that. And absolutely, we are all different. For me, it was progression. Now what? I'd done all the learning. I'd gone to Germany for that. I'd done my watchful learning. I knew because of that, the team I wanted to go with when it was time for me to get treated and where I wanted to go to get treated. I understood the available options, so I had that all in order. So I want to talk a little bit about giving back since I've already talked. The other thing that I like to do as part of my learn, network, give back, and have joy in your life is give back. And it's different for all of us. Just like our disease is different, some of us have money that we can put towards finding a cure or finding help and finding things to make us live longer. Some of us have time. Some of us have skills. All of them can be put to great work. This is our group up in Northern California. We do the Oakland Running Festival, where we have about 50 plus runners who run with 10,000 runners in Oakland. It's one thing that gives me joy to watch our group as it's grown. These are some of my resources that I use. IntegrativeOnc.org is the Society for Integrative Oncology. We do publish guidelines, so there are some guidelines for integrative care. Again, one of my great books that I read is Anti-Cancer, A New Way of Life. This was written by Servan Schreiber, it was a great book. We've heard a lot about nuclear medicine. The SNMMI puts out a patient portal, so you can learn a little bit about nuclear medicine from there. I run a site on PRRT called PRRT Info. I believe in guidelines. A lot of the times, especially if you're not going to a center and you need them to conform to what is generally accepted practice for us, at NorCal CarciNET.org/net-guidelines, We actually have both the North American, not both, but the North American Neuroendocrine Tumor Society guidelines, the UK NETS guidelines, the ENETS guidelines. We have guidelines on how to take an Octria scan because those are guidelines. I worked on the gallium-68 guidelines as part of what I do with society. Those guidelines will be up soon. The North American Tumor Society has their site as well called nanets.org that has guidelines up as well, and some other things. So I'm going to conclude here. I'm sure I talked past my 7 minutes, but the first thing is enjoy every sandwich. Learn, network, give back to your community, and have joy.